unfortunately, I got to have a 5-day vacation at Novant Hospital because I got COVID. And I'm like, if this is what bad looks like,
Yeah.
okay, and the payment has been made.
Wow.
Done.
Love
So
it.
easy.
That's the exciting part, because I love that. Okay, we already got a great program, but if you're EXP, because the numbers are so big. Hey, Kev.
Hey, Kathy, how are you?
Great. So I'm wanting to do a series of interviews with people who, after they came over to EXP, got the insurance with, what's the name of the company? I don't even know. Clearwater.
Clearwater, thank you.
Thank
You
you.
put me on the spot.
Sorry. Well, and it's funny because at my age, I don't need the insurance because I'm past that age. Darn it, and happy at the same time for that perspective. But I know that I was without insurance for 10 years when I moved here. I couldn't afford it, and then we had to have it. So then I get this monster deductible that was like not having insurance. And even when I raised my kids, I didn't have insurance when I raised my kids because it was such a big number when you're evaluating, like, how do I get by, And a lot of agents, that's a reality. It's like, do I pay taxes? Do I pay health insurance? What do I pay? So tell me some thoughts of your experience of why you decided to go with the EXP, because I know you're an analyzer. I know you dove into it. Tell me everything.
Yeah, and I could make some really bad jokes about the Ray Charles could have seen the need to make a change, because it was like all of this for me, it actually started, I think, with the 2016 presidential election. Like that's the point at which, for me, because there was all the debate that was going on about health insurance. And if you remember, like we had the Affordable Care Act that was put into place. And unfortunately, health insurance has become anything but affordable since that was put into place. Mine, at one point in time, I was paying $400 a month for health insurance, and over time it had gone from 400 to 800 to 1200, and also the deductible kept swelling. So by the time I was like, this has to change, I would probably be $27,000 to $30,000 out of pocket by year end if I paid all my premiums and paid the out of pocket money.
And
so
that's right?
That's for two healthy people, relatively healthy, right? So, literally, neither one of us take anything. We don't take any, all we take are vitamins. We don't have anything else going on. So it's like, we don't have any pre-existing conditions. We don't have any other, things that you would think would drive up rates, right? And so we were at almost $1,700 a month for our two people for Blue Cross Blue Shield. And we were at, I think, a $14,000 or $15,000 deductible between the pair of us.
Wow.
And it's just, and I would price it out with different brokers and do different things, and they're like, it is what it is. And I couldn't do it, and it was like, at a point now, like you said, I'm an analyzer. I'm like, maybe I just keep making, because really we're getting to a point where this is just like catastrophic coverage.
Yes.
Like, okay, you're not going to use it for going in for prescriptions or sniffles or anything else. This is like, you get in a major car accident, this is what you use, nothing else. When it was $1,700 a month, they were getting ready to increase it again. So I don't even remember what the number was. I just remember the last amount I was paying was almost 17. So then when the other was put in front of me, I thought something was wrong. Like, okay, am I only allowed to go to, doctors in third world countries? Because it literally went from $1,700 a month to $700 a month. She and I saved $1,000 a month, $12,000 a year. And the deductible went from $14,000 to $2,500. Right now, all of us are experiencing inflation.
Yeah.
Cost of eggs and bread and, anything we're buying has gone up since 2020, has gone up about 20%.
Right.
So this is deflation. We've literally, just at the out-of-pocket monthly, we've saved $12,000 a year. And you think about, how would you use $12,000 a year? Whether somebody might want to use it to pay for things they wouldn't be able to do otherwise. Like you started out with, some people are making choices about, I can't do this because I have to do that. Well, now it gives you that freedom with some discretionary spending. So that was just the cost side of it. But I will tell you, when it first happened, Shelly was not happy with me
Mm.
because I was the one that basically made the decision and said, we're going to do this because this is ridiculous. And I did call around to some other people who had used it, and they said it's fine. When Shelly first started going, like in North Carolina, Blue Cross Blue Shield is the 300-pound gorilla of health insurance. So when you go to a doctor's office and they say, let me see your insurance card, and you put it across the desk, they see the Blue Cross Blue Shield logo, kind of a done deal. It's easy. You put the other one across the desk for Clearwater, and they're like, what's this?
Hmm.
And they start giving you the weird looks and everything.
I didn't know that.
I got that. Okay. But here's the fun part. Sorry. Here's the fun part with this is let's fast forward. In 21, unfortunately, I got to have a 5-day vacation at Novant Hospital because I got COVID.
Hmm.
And racked up a pretty hefty bill as a result of being there. I didn't know what to expect when this was done. And when I got Blue Cross Blue Shield or Novant, I'm sorry, it sent me all the bills, and there was a lot of them. I didn't know what to expect, but I took all of them, bundled them all up in one email, and I sent them to the insurance company, Clearwater. And when I did that, I got on the phone with a nice young lady, and she went through everything with me. She made sure everything was correct. And literally 2 days later, I got an email from them saying the payment has been made.
Wow.
Done. It was months later. I got another bill because the hospitals are notorious for billing up to a year later,
Yeah.
because somebody catches it and they realize, oh, we got to bill them before the year is up. So months later, I get another bill. I do the same thing. I forward it on to the company. I explain it. Yes, this was part of what happened. And that day, I got an email. The bill has been paid.
I love that.
And on top of it, she apologized to me. She said, our systems and our process isn't really that good right now, but we're implementing a new concierge system. And I'm like, if this is what bad looks like,
Yeah.
okay, and you're implementing and rolling out something even better next year. I don't know, and thank God I haven't had to use it. But I mean, just back then when they thought it was not good and needed improvement, it was fantastic. Because I remember, having to get things done with Blue Cross Blue Shield, and it's forward me on to this person, and then you get to them and they don't know why you're talking to them, and you get forwarded on to someone else. No, total concierge process. You get connected to one person, you talk to one person, they clarify everything, they take care of your claims, done.
Love that. Love
So
that.
easy. And it's a level of service that I think most people don't really, we think is gone.
Yeah.
Because everywhere else, it seems like the level of service has kind of really fallen off, and they've done the opposite. So you get more for less.
It's incredible. It's incredible. I was talking to Margot Rickersham, who is one of the salespeople or directors of Clearwater, and she introduced me to the company president. And I was talking to them, and I said, so is this only for EXP agents? And he goes, no. He goes, we can't allow it to just be only for EXP agents. He goes, but our pricing discount is special for EXP agents. That's the exciting part, because I love that. Okay, we already got a great program, but if you're EXP, because the numbers are so big, well,
Yep.
I mean, we're massive and continuing to grow. So that was exciting to me. He said that we were limited. We're not allowed to make it exclusive to EXP government rules or whatever. So we
Sure.
went ahead, just made a great break. He said, well, that works for us. And I have talked to more agents like you that have saved $1,000 a month. And if you add that up, there's 12,000, and here's our cap at 16,000. Shoot, that just made your cap a wash of 4,000. And then when you figure in some of the other benefits, which you can get all that back anyway, I mean, it's like you and I were just talking about EXP. People don't come for just the cap or the rev share or whatever, or the stock. They're coming for a lot of different things. And I think the health insurance is a biggie.